Welcome back, viewers. Today we shall be talking about the armamentarium used for local anesthesia delivery. Now mind you, right now we are only going to be concentrating upon the disposable syringe and needle system. In this video we are going to be talking about the parts of the syringe and the needle, how they are integrated together, and what are the details about the needle itself in terms of the length of the needle and the bevel and gauge of the needle. Now with this, let's first start out with the disposable syringe. A word of caution, please remember that the disposable needle syringe system is basically used along with a vial of local anesthesia. Okay? As a side note, kindly understand that the bottle of local anesthesia or the 30 ml packaging of local anesthesia is what is called a vial. Now a vial is a multiple dosing packaging wherein multiple times you can withdraw the drug from the packaging itself, that is the bottle. This is exactly opposite to the cartridge system. Now the cartridge system is a single dosing packaging which is analogous to an ampule, which is a small glass bottle. Now with that in mind, let's first start out with the actual disposable syringe. Now in this packaging, this is a 2 ml syringe. You notice that it has a syringe as well as a needle in it. Now before you actually open this, please note that you should always read the labeling on the back. Now if you notice here clearly, there are a few pointers, right? And there are a few symbols on the side. Okay. So first of all, let's understand that this is a 2 ml syringe. Okay. Now there are some specifications given vis-a-vis the needle itself. Now along with that, you have to always remember to also check the manufacturing date as well as the expiry date. Now if you notice, this is very much within the expiry date. Having said that, we also need to understand the needle dimensions. Now if you notice in the bracket, you have 0.55 times 25 millimeters, and then beyond that you find a number written as 24G times 1 inch. Okay, so what this basically means is these are the dimensions of the needle in the metric as well as the imperial system. Now the metric system of measurements is basically in millimeters, whereas the imperial system of measurements is in inches. Okay, now the 0.55 refers to the diameter of the needle, whereas the 25 refers to the length of the needle. Now the same thing in the imperial system is the 24G, that is the 24 gauge and 1 inch. Now let's first quickly talk about a little in detail about the gauge of a needle. Now please remember, the gauge of a needle is a measure of the diameter of the needle itself, particularly the internal diameter. Now the gauge is a number that is inversely proportional to the actual diameter. What that means is, as the gauge number increases, the diameter of the needle decreases. In other words, a needle of 24 gauge is going to be thicker than a needle of 30 gauge. At the same time, a needle of 24 gauge is going to be much thinner than say a needle of a 14 gauge. Okay. Now with that basic difference in mind, let's go ahead and understand the symbols. Now if you notice these symbols here, you have the symbol where the 2 is crossed out. Now this 2 basically tells you that the instrument within this packaging should not be used more than once. You notice that it says sterile EO, that means this instrument has been sterilized by ethylene oxide. You then have a marking which specifically tells you that you do not autoclave this instrument. Okay, so with this basic out of the way, let's also look at a few details just below the labeling, where you see it says sterile syringe and it says non-toxic, non-pyrogenic. What that means is that this instrument or this syringe in particular is not capable of producing any fever, or it is devoid of any antigens that may cause fever-like symptoms. So that is what it means when it says non-pyrogenic. Non-toxic obviously refers to the toxicity of the material itself. So it has been tested and proven that this is a non-toxic syringe. Okay. Now with that basics in mind, we now go towards opening the syringe. Now how do you open the syringe? If you notice, right at the end, you will see that there is a flap of plastic that is separate from the paper. Okay. So this is basically called a blister packaging. Okay. So what you do is there are two ways. The first thing, you have to hold the plastic and the paper and you need to separate them. That is basically how you open a syringe. Now, in case you are assisting somebody and you already have a surgeon or someone else who's gloved up, this person is going to collect the instrument directly from the packaging, or you may want to invert the packaging and drop the syringe and needle right onto the sterile drape. Discard the packaging aside, and now let's particularly look at the actual syringe needle assembly. Now let's first talk about the syringe itself. This is a 2 ml syringe, like you can clearly see from the graduations. Now let me just disassemble the syringe itself. Okay. Now the white part, the white plastic part that you see is called the plunger, and then you have the barrel. Now within the barrel you see some graduations of the markings of the ml marking, and other than that you notice these plastic outcroppings. They are called the finger flanges, where your finger rests when you are actually injecting, and then you have the needle adapter. This is the part of the syringe that accepts the needle. Okay, so let's just quickly reassemble the whole system, and if you notice, this is how the syringe gets assembled. Now this is a now if you notice, this is how the syringe gets reassembled, and mind you, this is a aspirating syringe, which means that you will be able to aspirate and inject with this syringe itself. Okay, as a side note, kindly understand the configuration of the adapter. Now this adapter that you see over here is primarily what we call the lure slip adapter. Okay, now what is a lure slip? A lure slip adapter is where the syringe adapts onto the needle simply by frictional grip. There is no other mechanism by which the needle engages with the syringe. Okay, this generally has a taper of about 6 degrees so as to achieve adequate retention as well as the ability to detach the needle from the syringe when you are done. Now, similarly, there is another system called a lure lock system. The lure lock system basically contains a screw thread around the adapter, wherein the needle gets locked into the screw thread when you engage it. That prevents accidental dislodgement of the needle while injecting. It is a more secure method of adapting the needle onto the syringe. Now, with this basic in mind, let's move on to the actual needle itself. Now, if you notice, this needle is having the configuration of the adapter, that is the plastic adapter that goes onto the actual syringe, right? You then have the white part of the needle adapter, which is actually holding the metallic needle in place. That is called the hub of the needle. You then have the barrel of the needle, and eventually you have the needle tip, which obviously has a bevel. Okay, now let's quickly also have a word about the needle anatomy. So like we said, the needle is accepted onto the syringe in this lure slip method by simply frictional grip and then can be dislodged. At the same time, understand that the actual needle barrel is attached to the adapter via this hub, this white color hub. Now this, mind you, is the stiffest part of the needle. That means when the needle flexes, it is this part that does not move. It remains stiff. And because of that, this forms a point of anatomical weakness. In other words, when you are injecting, you have to ensure that the entire length of the needle is not inserted into the tissue, by which, in case you do that, you end up having a separation. The needle is going to separate at the hub and the entire needle is going to be inside the patient's soft tissue as such. But if you inject with a part of the needle outside and by some unforeseen circumstance you have a needle separation, you still have a part of the needle that can simply be grasped by either a hemostat or a curved artery forceps, and the needle can simply be pulled out. And that is the reason why the entire length of the needle should never be inserted into the patient's soft tissue when you are actually giving your local anesthesia. Now, coming to the bevel. The bevel of the needle has a leading edge and a trailing edge. The bevel of the needle basically helps in better penetration of the actual needle into the mucosa. At the same time, it helps in delivering the solution easily. Because it has a bevel, the solution can easily be deposited without hindrance or complete occlusion of the actual needle opening or the muzzle of the needle. When it comes to the needle itself, there are two major parameters that decide on the choice of the needle for a particular anesthesia injection. That is the length of the needle and the gauge of the needle. Now let's first talk about the length. The length of the needle generally pertains to the depth to which you have to inject. So it is considered that whenever you are planning on injecting for your blocks, like your inferior alveolar nerve block, you would prefer a longer needle like this one. Now this, mind you, is a 27 gauge needle, which is of course, like we know, a thinner needle. But if you notice, it is a 1.5 inch or 38 millimeter needle that we have. Now I'll just quickly show you the difference in length. If you can notice, you have the shorter 1 inch needle and then you have a longer 1.5 inch needle. These two lengths, mind you, are the most common set of lengths that are used in dentistry on an everyday basis. Of course, you do use shorter needles for PDL injections, but for the purpose of this particular video, we are going to be concerned with these particular lengths. Now, other than the inferior alveolar nerve block, kindly remember that for the posterior superior alveolar nerve block, because we are in close proximity to vital vascular structures in the area of injection, we would prefer to use a short needle. Okay? Now, with that out of the way, let's talk about the gauge of the needle. Number one, the gauge of the needle primarily deals with the ability to achieve positive aspiration. Now, according to a study quoted in our textbook of local anesthesia, that is the Malamet textbook, we'll clearly understand that up to a 25 gauge needle actually gives you 100% true positive aspiration. That means if you are inside a blood vessel, you will achieve 100% positive aspiration if you use a 25 gauge needle and above. At the same time, a 27 gauge needle is giving you up to 87% true positive aspiration. That means about 13% of the times, despite being inside the blood vessel, you may end up getting a negative aspirate. Also, there is another parameter in this study which says that a 30 gauge needle gives you a positive aspiration rate of only about 2%. Okay. Now, whereas other studies have also proven that whether it is a 23 gauge or a 30 gauge needle, the rate of aspiration generally does not differ as much. There are two contrasting views on this, but kindly remember that the larger gauge needle gives you the better chance of getting a true positive aspirate in case you are inside a blood vessel. Having said that, the gauge of the needle also determines the amount of deflection that takes place when you actually enter tissues. Of course, the amount of deflection of a needle is also dependent upon the density of the tissue that you are entering, but it plays a vital role, especially when you're using a longer needle, by which the needle traverses a longer distance inside soft tissue. And because of this, it is recommended to use the BRIT, or the bidirectional injection technique, or bidirectional rotational injection technique, so as to overcome the deflection of the needle that you may actually see. With that, we come to the end of the video on LA Armamentarium. I hope this video was helpful for you. Thank you.